shopping runs, going to the salon, but you made it. Thank you for making the time, okay? After this, we're going to go right into our pre-quiz. We'll take a few questions just to test our knowledge gain of this subject matter. And then our guest speaker, who has been waiting patiently for us to get into the room, who took the time today to come because she truly enjoys, she's passionate about the subject. She's waiting in the room to deliver an excellent didactic presentation on the subject matter of breastfeeding and skin-to-skin contact, okay? Not only that, afterwards, she'll be on hand to take your questions. So come ready, write them down, note them somewhere on your notepad. She'll be on hand to take your questions, okay? And then we'll take our post-quiz and we'll bring the session to a close. So thank you once again for joining. My name is Elizabeth and I'll be taking us through today's session. Thank you for joining. Next slide, please. All right, so like I mentioned earlier, just a quick housekeeping rules. Our Digital Mom project leverages the ECHO model. So we collected some data around your participation, your registration. Please be assured that only the relevant personnel will handle this data for insights and for evaluation and research on how we can continue to improve our interventions. Okay, thank you so much. Next slide, please. Okay, not only that, this session will be recorded and we'll be sharing a version of the slides after the session for everyone who would like to, have it on hand for continued learning and who wants to share as well. Next slide, please. Okay, we'd like to encourage everyone, please have your cameras turned on so that we can all feel like we're in the same room. If you need to speak, please signify with the raised hand function button, or you can let us know in the chat and the facilitator will unmute you to speak. If you have any comments, conversations, we want to encourage us. Let's make this very interactive. Go in the chat, type something there. And if you need any technical support, our team are on standby to provide that support. Next slide, please. Okay, I think it's wonderful. It's very important that we take some time to know who is MDoc Healthcare. Why are they passionate about, why are they taking the time on a weekend to have a session like what we're having today? And I'll just briefly tell us that MDoc Healthcare is a digital health organization that's providing self-care support for persons either living with chronic disease needs like diabetes, hypertension, cancer, or persons living with regular health needs like the mom on a pregnancy journey or the mom who has just had a baby. We are passionate, we're intentional about providing support that helps individuals know how to better manage their health and live healthy and happier lives. And we leverage a four-pronged approach, the first of which is our complete health app, where you get access to coaches, you can track and monitor your health metrics, get access to community forums, where you can get peer-to-peer support and just get access to all the resources that you need for your health journey. Okay. Not only that, we also leverage our Navi Health platform. I spoke earlier about how we are elevating women's voices. We want more women to be able to share what's the quality of care you're receiving at your health hospital, your facility. How can that quality of care be improved, right? So improved upon, I beg your pardon. So we are also generating reviews through our Navi Health platform. We call it the Google for hospitals. So anyone can go on there to look for a facility or a hospital that provides the care they need. And when they are done, they can leave reviews just like the way you do on boats, or you do when you go to a hotel, or when you see the suggestion box, you can leave a review on your experience of care. Thirdly, even though we're a digital technology facing organization, we're also supporting and augmenting our virtual support through our community nudge hubs, where persons can get in-person coaching support. You can also go and track and monitor your health metrics at the nudge hubs. And then lastly, our MDoc Quality Network, which is the platform through which we're delivering today's special session. This platform basically provides capability building trainings for both healthcare workers and the members that we serve, including you who has joined today's session. Okay, next slide, please. We'll just take a brief minute to just see a demo about how Complete Health works, how you can sign up, how you can onboard. A member of our team will put the link in the chat if you would like to get onboarded or subscribe on the Complete Health platform. Roger, next slide, please. Thank you.
This video is a brief walkthrough through our Complete Health mobile application. When you download the app, it takes you to this page and then you can choose to either sign up or log in. To sign up, please include your first name, your last name, your email address, your phone number, and a unique password. Please ensure that the password is strong, it is unique, and it is imputed twice. After that, you can now create an account. When you click on create an account, a verification code is sent to your phone. Kindly input the verification code and your account will be active. Now you can proceed to fill in your profile. In your profile, you need to fill in your gender, your date of birth, your height, and your weight. Your height and your weight are necessary because this is required to calculate your BMI, which is your body mass index. And after that, you fill in your level of education and your income level. So after signing up, the next thing to do is to subscribe for a program. To do this, please go to the home page and click on your name. After that, click on profile information and then click on subscriptions to the right. This will take you through a list of the available programs at MNOC. So for the purpose of this video, let's select Propel and we'll select free version and click on checkout. Checkout confirms payment and immediately takes you to fill out a BLA, which is your baseline assessment. After filling the BLA, you'll be automatically assigned to a health coach. Now, to confirm your subscriptions, please go to your homepage and click on My Subscriptions. This will show you the list of all the programs you subscribe to, highlighted in green. You can click on the programs to find out your assigned coach and also retake your BLA if you fail to do so initially. Thank you for watching this video.
Wonderful, thank you. Next slide, please. I think we can move past the slides. We've already spoken a bit about this. Akinwale, just urging that you kindly put in the chat the links to Navi Health and Complete Health, so that as many people as want to get subscribed on Complete Health can do so with our support today on the call. Thank you. So we'll go right into our pre-quiz. We have a few members just joining. Thank you so much for launching the pre-quiz test. I'd like to encourage everyone. If you've just joined, we're just taking our pre-quiz. This is very important. Don't worry about your answers are purely anonymous. We just want to see, get a sense of your knowledge about the conversation today before the speaker comes to share, just so that we can measure and test knowledge gained from today's session. So I want to encourage you, please try to take the time to go through it. Just 10 questions, and they have multiple choice for you to choose the right option. Thank you so much. Thank you to everyone who has started to respond. Thank you so much for your responses. Please keep them coming. If you're having challenges seeing the quiz on your screen, please look for the triple dots at the bottom of your screen that says more. Click on it and you should be able to access the polls. If you still can't see it, please let us know in the chat. Someone will provide support for you to get access to the pre-quiz. Thank you so much. If you're just joining us, we're taking our pre-test quiz right about now. We want everyone to participate, okay? This is very important for us so that we can measure knowledge gain in today's special session. So please make sure that you're taking the pre-test quiz. It should be up on your screen, but if it's not up on your screen, please look for the triple dots at the bottom of your screen and click on it. It should take you to the right option. Thank you so much, Dorothy. Thank you, everyone. We have just a few more minutes to go, so I'd like to encourage everyone, please try to take the pre-test quiz. If you are in the room, then the pre-test quiz is for you, okay? Just encouraging everyone. Thank you for joining. Thank you for being a part of today's session. If you've just joined, our pre-test quiz is up. Please try to take the pre-test quiz because this is very important for us so that we can measure our knowledge gain in today's session. Thank you once again.
Make you enjoy yourself now.
All right, we have just 3 minutes to go. I'd like to encourage everyone who's taking the pre-test quiz, please try and complete it. If you're just starting, we're waiting for you. We really need all of us to contribute and try to attempt some of the questions. Don't worry, your answers are purely anonymous. Don't worry. Just try, give it a trial, okay? And then you'll get to see as soon as the session starts, next steps from how well you have done on the quiz, okay? So I'd like to encourage everyone, please participate. Thank you so much. Two minutes to go. We're almost there. Encouraging everyone to please take the pre-test quiz. All right, just the train is leaving right about now in about a minute. I see some people are just trying to finalize their answers. So we're just giving you just a few more 60 seconds to complete your responses, and then we're bringing this to a close. TikTok says the time. Just waiting for us to finish including our answers so that we can move on to the next part of the session. All right, so we're going to bring this to a close now. Thank you so much, Dorothy. And Roderick, over to you. Okay, we just want to, before we go on, I want to just take the time to note that if you have members, friends, members of your family, friends, colleagues, other moms that you know would like to participate and benefit from this session, please, we're also live streaming on YouTube. We know it's probably past time for them to register and join via Zoom, but they can join the training via YouTube. So a member of the team will drop the link to YouTube in the chat. Please share that link with them. Please do not share your Zoom link with them. You can share the YouTube link with them so that they can join the session and they can also participate in the conversation. Okay, thank you very much, everyone. So move right into it. Today's special session, we have the honor and the delight to have Dr. Enemi Isiche join us today. She's the founder, Learning with Dr. Amy. She's a passionate and dedicated medical doctor with over 14 years of invaluable clinical experience in pediatrics. We did an MBBS degree in medicine, a PGD, a postgraduate diploma in pediatric nutrition, and a 7-member of the Pediatric Association of Nigeria with several certifications to boot. Dr. Isiche is committed to the well-being of children and is passionate about galvanizing the support everywhere she goes through her platforms, empowering parents with the knowledge and skills they need to provide optimal care for their children. And I can prove it to you that this is not just wash or mouth, right? Today alone, she's had another session where she's going to talk about parenting and encouraging people, on the right ways to raise children, nutrition. So Dr. Isiche she's fully loaded and packed and ready for us, okay? So I'd like to encourage you, please make sure that you are present and that you receive all the insights she'll be sharing, expert insights she'll be sharing to this session. As a trusted and sought-after resource person in pediatrics, her love for children is evident in public health promotion efforts through her social media pages. She shares her wealth of experience there on preventive care and early intervention tips on childhood illnesses. Ladies and gentlemen, for the gentlemen that are in the room today, I'd like to encourage you, please, with a warm ovation in the chat. We need to make Dr. Isiche feel very welcome. So I want to see our claps, I want to see our balloons, I want all the emojis that that we can use to bring Dr. Isiche on board, to come take over the mic. Please celebrate Dr. Isiche as she comes to deliver her presentation. Next slide, please. Thank you very much. Hello, Dr.
Thank you, Elizabeth.
All right, great.
Yes, can you hear me? Thank you, Elizabeth. Thank you, everyone. Can you hear me loud and clear? Yes. Okay. Thank you very much. Thank you. I'm so excited to be here. Like you said earlier, I'm really passionate about teaching mothers, parents about what it takes to raise healthy children that can thrive. And marking this World Breastfeeding Week, I love the topic, the theme for our discussion that says latching onto love, unpacking the amazing benefits of breastfeeding and skin to skin. In fact, the word latch, someone will say it and say, which one is latch again? What do they mean by latch? Is it the thing we used to put on the door, to close the door? Of course, it's not. Latch just simply means how the baby attaches to the breast, because it is very, very important. And we're going to find that out in our discussion. So let's just dive into the slides. Okay, so let's go into, so for this discussion, we're going to be looking at this outline. We'll try to introduce and talk about the importance of exclusive breastfeeding, how we can promote effective breastfeeding practices. And then we're going to be busting some people's bubbles in this conversation today, some myths and misconceptions about breastfeeding. We're going to be busting those myths. And then we're going to talk about how we can support women, because, it is very important how we can support women, during the postpartum period, and even for mothers that cannot breastfeed, what can be done, and what are the practices that we can do to advance breastfeeding. So we can go to the next slide. So like we all know, breastfeeding is the most effective way to ensure that the child, like babies, get the right food for optimal growth. In fact, I like the fact that Elizabeth started off by talking about statistics, because the goal is that if every woman can breastfeed, WHO envisions that by 2030, at least more than 50 people would, as in there will be more than 50% increase in breastfeeding. And what will this do? It will increase the survival rate of 820,000 babies each year. That's so amazing. That's so amazing. So it's really very important. And it's important also that breastfeeding should be commenced within the first hour of birth. So it doesn't matter if it's a vaginal delivery, if it's a cesarean section, whatever form of delivery, breastfeeding should be commenced within the first hour of birth. It is possible. You can do it. It can be done. It should be done. Okay, and why is it important? Because if breastfeeding is commenced within the first 1 hour of birth, it will promote emotional bonding between the mother and the baby. And once that after the woman has gone through labor or cesarean section or the pain, once the baby is given to the mother, skin to skin contact, baby touches the mother's skin, that joy of hearing your baby's cry, it has no bounds. There are no bounds to it, right? So that emotional bonding stimulates the production and release of breast milk. And the first 1 hour of the birth, we call it the golden hour. Is the golden hour, because in that first 1 hour, that's when that first few days, that's when colostrum, that golden milk begins to come out, right? So it's very important, because that milk, we usually say that it's the first immunization that the child receives, because it contains antibodies to protect the child against infection, and then it contains all the nutrients that the child needs, right? So we keep saying that mothers should breastfeed their baby exclusively. That means no water, only breast milk for the first 6 months of life. And someone is saying, me that is an adult, when I eat, I have to drink water. Why are you saying I should give my child only breast milk without water? Because the breast milk has more than 85% of water. Breast milk alone has water. So it has water. So baby doesn't need water. So the mother needs to give their babies only breast milk for 6 months. And thereafter, after 6 months, we start complementary feeds, right? And then you can continue breastfeeding to up to 2 years. So the common practices we see women doing is I would ask a mother, okay, did you exclusively breastfeed? She would say, yes, I gave my baby breast milk and water. So if you're a mother here and you're giving water, that's not exclusive breastfeeding. It is only breast milk. So when you give water to your baby with breast milk, that's predominant breastfeeding. So that's not exclusive breastfeeding. Baby doesn't need water. So it's important to give only breast milk. Some mothers will do mixed feeding. They will give their babies, breast milk and formula feeds, and they will say, my breast milk is not flowing well, or this baby wants to dry me, I have to do something. No, it is possible. And then, of course, some mothers will give formula feeds, right? So we're going to talk about, we'll let you know about formula feeds. I'm going to also share my experience with you. But what is recommended and what is best for survival of our babies is exclusive breastfeeding, which is only breast milk for the first 6 months of life. Next slide, please. So what are the benefits? Why are we emphasizing on this? Now, it's very important. It's very important that because the breast milk contains all the nutrients that the baby needs, all. And what also stands breast milk apart is that it contains antibodies, right? So in fact, each time a mother breastfeeds her baby, she transfers antibodies to her baby. And what does those antibodies, what do? They help the baby, they protect the baby from infection. Remember that when babies are born, you remember when you have a baby, you say, oh, go and wash your hand before you come and touch my baby. Especially if it's a preterm, no, go and wash your hand. If you're coughing, please don't come near the baby, because you already know that the baby's immune system is not mature. It's still like developing. So, but because the mother is breastfeeding, she's transferring antibodies that will protect the baby from infection. And this is what no formula feed has. Formula feeds would have nutrients, yes, but no formula feed in the world has antibodies that can protect a baby from infection. So breastfeeding prevents asthma, bronchopneumonia, it prevents diarrhea. You're not worried about the constitution. You're not worried about, oh, did I cover it well? Did they wash the feeding bottle well? Oh, is the milk bad? Is this a new tin of milk, or is this a milk that I've opened for like more than 30 days and so it's bad? You're not worried about diarrhea or anything, right? And breast milk in itself contains growth factors. It contains taurine and cysteine. These things help the brain, the myelin sheath. It helps the development of the brain. And so studies have shown that children that are exclusively breastfed have a very high intelligence quotient. And then this very next reason that it prevents sudden infant death syndrome. This is very, very, very important. According to the American Academy of Pediatrics, that it prevents SIDS by 50%. Now, the question you want to ask me is, how does it do that? Breast milk is easily digestible, right? So as a baby takes it, it's easily digestible. And because it is easily digestible, the risk of a baby having reflux is lesser, right? And when mothers put their babies to breast, as they keep bonding with their baby, they become more aware of the baby's cues. They're able to understand how the baby is. So they are able to understand if the baby has any problem. And it's also been shown that babies that have syndrome of infant-dense syndrome, they probably, a study showed that 45% of them probably had a respiratory tract infection like 2 weeks before that sudden infant death, right? And then, the goal that we teach mothers is that when you have a baby, you should practice the ABC of sleeping, meaning that the child should not be left alone to sleep, right? Don't sleep. Your child should not be left alone to sleep. The child should sleep on their back, and then the child should be kept in a crib without anything to avoid suffocation. Now, let me ask you a question, because I want us to participate in this conversation. Let me ask you the question: which is easier to do? Throw something up. Which one are you going to put more energy? If I'm throwing this stuff, I throw it down like this. Which is easier, throwing something down or throwing something up? Which one? I want to see your answer in the comment section. Which one are you going to use more energy to do? Is there more energy in throwing something down or throwing? Yes, I can see Dorothy. Yes, throwing down is easier. Throwing down is easier. Correct. So that's why I want to tell you why we tell mothers that babies should sleep on their back. Now, I have this because I like to teach and I like to give example. So just see this little thing I have here, right? Now, from our noses and our mouth, right, we have two pipes. We have the food pipe and the wind pipe. The wind pipe is, what allows us to breathe, right? The food pipe is what takes food in, right, to our stomach and all of that. So usually, the food pipe is behind. So just take this teddy bear here, this whole thing as the wind pipe, and take the flap, this flap here as the food pipe. So usually the food pipe is behind the wind pipe normally. So when a baby lies flat on the back, you see, you have the food pipe behind and you have the wind pipe. So if the baby, per adventure, maybe regurgitates, right, it's difficult for it to go into the airway because you've already told me that it takes more energy to go up. But if you turn the baby lying flat, you now have the food pipe above, you have the wind pipe below. If the baby regurgitates, the food will just go straight into the airway and then cause aspiration and baby will die, right? And then, of course, babies, when they are born, they really can't move their neck like that. So when they lie down flat on their back, when they lie down flat on their tummy, they can also suffocate. Let me go quickly into the discussion. So breastfeeding also prevents necrotizing enterocolitis. This is very important, especially in preterms, right? Because what happens is if the child takes a contaminated milk, the intestines can get infected. When they get infected, they get inflamed, the infection spreads, and the blood supply to the intestine is cut short, and then the child will need surgery or the child can even die. So, but with breast milk, because of the antibodies that are in it to prevent infection, it protects the baby. Now let's move to the mother. Now, in fact, I love to say that breastfeeding is free, it's convenient. You can breastfeed your child anytime, anywhere, how, as in like, you're not thinking, you're not worried. And then, a tin of formula feeds up. Some of them are 7,000, some are 15,000, right? It depends on what you're getting. So you're not worried. It relieves you of that stress of calculating what to do in the first 6 months when you have your baby, right? And then it promotes bonding and also prevents the risk of breast cancer. Yeah, and these breastfeeding prices have gone up, you can imagine. So it decreases the risk of breast cancer. How does it do that? Each time a woman breastfeeds, when you breastfeed, you shed breast tissue. And as you shed breast tissue, the DNA cells that are likely to be cancerous are shed away. So that's how it protects against breast cancer. It protects against ovarian cancer because when a woman is breastfeeding, she's not ovulating, she doesn't really ovulate like that. and she's not ovulating, she's not releasing estrogen that can lead to cancer, right? So that's one of the reasons. And then when a woman also breastfeeding helps to increase high density cholesterol, which is a good cholesterol. It helps to increase catabolism. And so because of that, that woman has a decreased risk of having high blood pressure. And then another thing that breastfeeding does, it increases, insulin is a hormone that mops up glucose. So it increases the sensitivity, the ability for insulin to mop up glucose. So that's how it reduces the risk of type 2 diabetes. And this is the best part that I love for mothers that like to slay, right? If you're a mother that love to slay here, let me just see your hands in the comment section. So, we usually say breastfeed. Why are we saying breastfeeding? Because, there are two hormones. You have the prolactin that helps the breast milk to help with breast milk production, and then you have the oxytocin that lets the breast milk to be let down, to flow out. That hormone, oxytocin, that lets the breast milk to flow out, that's the milk let down hormone, is the same hormone that causes your baby bump, the uterus, to contract. So each time you breastfeed, your uterus contracts, and as your uterus contracts, it begins to go back to its pre-pregnancy size, right? So it's easier for you to go back and slay, and then it helps the mother to lose weight. So each time you breastfeeding, the mother loses about 500 calories as she breastfeeds. But I would like to say that don't go and take my word and say, yes, I will lose weight. So you begin to eat for 2 or 10 because you have to, there needs to be a balance. There needs to be a balance with what you're eating, but it helps the mother to lose weight as well, because as you breastfeed, you burn calories. Okay, next slide, please. Okay, so now the question is, why are we emphasizing on exclusive breastfeeding? Is it possible? I'm telling you, it is possible. I said I'm going to share my experience. It is possible. Now, the most important fact is that studies have shown that babies that are breastfed for 6 months and above have a reduced risk, a 20% reduced risk of having leukemia. Why? Because the breast milk is a prebiotic, and it also it has lactoferrin in it, right? And so it helps to shaping the baby's I'm trying to use simple words, right? So I put here infant gut microbiome. It basically just means the baby's intestinal lining, right? And it's been shown that the cell the B cell precursor that causes leukemia is linked to the gut microbiome. So you see that breastfeeding for 6 months is protective, right? And then it helps because of the antibodies. It prevents against gastrointestinal infection. It prevents against allergies, ear infection, and then you're not even anxious. Because you're breastfeeding, you're not anxious about any contaminant going to your baby, because you're giving your baby straight from the source, right? It helps the baby, to grow healthy, and then it also leads, as you continue to breastfeed for a long time, it leads to lactational amenorrhea, because of course it's with breastfeeding, ovulation is reduced. Now, are we saying formula feed is bad? If you're giving your child formula feeds, in fact, you have done wrong. The truth is that formula feed is a suitable alternative to breast milk, but it is not the best. Exclusive breastfeeding is the best. Formula feeds do not contain antibodies. It do not contain antibodies that protect the baby from infection. There are situations where a mother may have to give formula feeds, right? Which is true, right? There are situations a mother will have to give formula feeds, but then you have to. So I like to give parents an informed decision. Well, one of the reasons is that formula feeds I put here contains whey protein. Whey protein is the protein that is easily digestible, right? So for breast milk, the percentage of whey protein is 60%. You have 60%. So that's why, because of that, the children, they eat, they digest the food, they get hungry again. But for formula feeds, the percentage for whey protein is 20%. So they have more of the casein. So they get, they can easily get constipated, right? And so when a mother comes to me and tells me that, I'm sure some mothers, I want to see your comments in this section. Are there times that you've had your baby and you're worried, like, my baby has not passed through for 3 days, my baby has not passed through for 4 days? Some mothers come to me and are worried, they have their newborns. And the first question I go to ask is, well, how are you feeding? Are you giving only breast milk exclusively? Are you exclusively breastfeeding your child, or you're giving formula feeds? If the mother tells me she's exclusively breastfeeding, I'm not worried. I ask her, okay, your baby has not passed through, or your baby is passing gas, like your baby is farting, right? Yes, she say yes, my baby just producing, but there's no stool. Your baby's stomach is not distended, right? She said yes. I said it's normal, because the breast milk contains more than 80% of water. So that water gets digested, the baby uses it. So your baby may not pass through, even up to 5 days. A child that is exclusively breastfed may not pass through. I'm really not worried. As long as the child is passing gas, the abdomen is not distended, because the mother is giving only breast milk. But if you come to me and you're giving your baby formula feed, and your child is not passing through, I'll tell you, because of the casein that is more, I'll say, okay, you have to add water because it's not digestible. So you need to have add water so that the baby can pass through. Of course, formula feed predisposes to diarrhea, to allergies, even to syndrome of inappropriate syndrome of sudden infant death syndrome. And then there's a need, in fact, the worry about it being affordable. Can you afford it? Can you sustain it? That's the question in this economy. Can you sustain it? Those are the questions you want to ask. And remember that because your child's immune system is just developing, right? You cannot be going from one formula feed to the other formula feed. You're just predisposing your child to more infection. And then most problem we even have, right, is even the constitution. They are not, you have to know how to constitute it properly, because if you don't constitute properly, then the child will have a risk of either getting hypernatremic dehydration. So all those things have to put into place, and then you begin to worry too much when you can just relax and just give your baby breast milk. Okay, let's go to the next slide. Once in a formula feed finished in 2 weeks, you can imagine. So it's not far-fetched, right? Let's go to the next slide. Okay. Now, so how can we promote breastfeeding? What are the things that mothers can do so that they can breastfeed their baby properly? The first thing is to stay together after birth, right? So unless the baby needs to be admitted, unless the mother is ill or something, the mother and the child should stay together after birth. They should practice, and then even after, even when they're discharged from the hospital, right? They should be in the same room. Practice remaining, stay in the same room with your baby so that you'll be able to bond better with your baby. And I love this part, this skin to skin. This skin to skin, it's so important, because when you put your baby skin to skin, you protect the baby. You protect the baby from infection, because your baby comes in contact with your skin flora. It helps you, it releases oxytocin. So oxytocin is also called the feel-good hormone. So that joy that, oh my God, my baby after the labor, a typical example, I went out with a friend recently, with my sister recently, and while we were out, she's a breastfeeding mother. So while we were out, she wasn't all she wanted to do. By the time we go home, once she saw her baby and she held her baby, her breast milk started flowing, flowing into her breast. And she was like, oh my God, while I was out, my breast milk was not. I said, because your baby has touched your skin, because of that joy that you're happy to see your baby immediately. So she wasn't breastfeeding her baby, but the breast milk was just flowing because of that joy. And that's what skin to skin contact does. It keeps your babies warm. It reduces baby stress. It regulates your baby's blood sugar. It promotes bonding. And it is so important, especially even when we have preterms. We got this skin to skin. I'm sure you've seen kangaroos. Kangaroos usually put their babies in a pouch, right? So even when the babies are preterm, skin to skin contact, helps the baby feel that mother's warmth. We encourage that a lot, right? It helps regulate the baby's temperature. So all of this is so, so, so important. And then another effective way to promote breastfeeding is to avoid stress, to avoid anxiety, and to understand that I know, I'm telling you from experience, breastfeeding is a skill. It's not, before I had my baby, when I'm in the newborn unit, and mothers, because when we admit newborns into the newborn unit, so we have the mothers come to breastfeed, and mother will say, doctor, my breast milk is not flowing very well. I'm like, madam, put the baby well. I'll not be like, are you a first time mom? She's like, I say, yes, that's why you're not holding your baby well. And you understand, don't worry, let me show you. Put your baby like this. It was easy for me to say, but when I had my baby, hey, I now understood that it was easier said than done, right? It was easier said than done. So I had to practice. I had to say, oh my God, so all this thing I was telling these women, I didn't know that it was not easy. I had to learn over time that, okay, I need to relax my back when I'm breastfeeding. I need to practice it. Anything, avoid anxiety. Get all the help you can. You cannot do everything by yourself. Get all the help. And that's why the theme is supporting women. And that's why we're here. MDoc is here. I'm here to encourage you that all of us are in this together, right? Know that you will learn. It's something that you will learn. And as you keep putting your baby to breast and practicing, you'll get better. Next slide, please. So yes, get your position and attachment right. It's very important. I like to show, right? So I have a doll here. So you will see mothers that carry their, that when you want to breastfeed, you see the mothers bending like this. You start bending. When you start bending, you bend over, bend your back. You're not comfortable. That is not a good. You have to learn to relax. There are different ways of different positions that have been shown here, but the major thing is that your baby's head will be in between your elbow here, And then your hand will now hold your baby's butt up, and then, you can easily relax. Can you see me very well? You can easily relax and breastfeed your baby. And then latching, you see the picture that we have here. So latching, like the thing, like what our thing is very important. If a baby is able to latch properly, you see that black part of your breast is called, around your nipple is called the areola, right? Your baby's mouth is supposed to cover the areola, at least the lower part, maybe a little above or so. And then your baby's chin will almost be touching your breast, like this picture we're seeing. If a baby latches properly, baby will be able to stimulate the hormones for the production of breast milk and the release of breast milk, and the baby will be full. But if the baby doesn't latch properly, baby's not going to be getting enough. So here, you see the baby crying. B and D look scary. How do you know if the baby is in this position? Is how they're holding the baby, right? They're just pictures, right? And if the baby is not latching properly, the mother will not have sore nipples, because the baby is not latching properly. The mother will not have sore nipples. So that's one of the things, right? And then another thing you can do is you have to breastfeed on demand. We usually will say, because the truth is that newborns, they sleep more than 12 hours in the day. When you have a newborn baby, they just sleep and sleep and sleep, right? So we usually encourage that you feed them every 2 to 3 hours, and then when they cry, you feed them, you check if their diaper is wet. If the diaper is not wet, you put them to breast, and exclusive breastfeeding for the first 6 months of life, right? And then you now have to look for signs that your baby is getting enough. What are the signs that your baby is getting enough, right? You begin to have wet diapers, right? The diaper, like you begin to get 4 or 6 diapers in a day, and then the baby begins to gain weight. I want you to know that newborns lose weight in the first 10 days. When your child is born, in the first 10 days, because you're coming with fluids, right? So in the first 10 days, baby will lose weight. But as long as the weight loss is not more than 10%, for instance, if your baby is 3.5, right, kilograms, and you go to the hospital and then baby now becomes 3.4, I'm not worried. But if the baby loses 350 grams, so the weight now comes to 3.1, I'm worried, because it's more than 10% of the birth weight. So in the first 10 days, they will lose weight, and then they begin to gain weight again. So if you give your baby exclusive breastfeeding, there will be a steady weight gain. Next slide, please. So now, okay, can we go back? Can we just go back to the previous slide? I don't want us to show this one first. Okay, no, go back to the latching. Yes, so I want to see in the comment section, what are the things that you were told about breastfeeding that you used to believe before, or you still believe, right? Or what are the things that you were told that you used to believe, and then you found out that is not true? Let's just quickly see it in the comment section. My breast will sag. Yes. We're going to be busting down myth here today. I want to see another person's comment in the comment section. I want to see another person's comment. What are the things that you were told about breastfeeding? Okay, some people were told that their breast will sag, that the breast milk will get sour. Okay, let me just dive in so I don't waste a lot of time. Let's go into the myth. No water. That the breast milk doesn't have water, so you have to give water. People say, I will drink more soup, I'll get more. If I drink more soup, I'll get more milk. Okay, so let's go to the next slide. That the breast milk is not enough. True. So if you're a mother here, in fact, I want to see in the comment section. I have all it takes to take care of my baby. I have all the milk to give to my baby. I have all the breast milk. I want to see it in the comment section. I have all the breast milk that my baby needs to live. You have, because the truth is that, yes, I don't want to jump above myself, but the truth is that you have everything it takes to breastfeed your baby. That's why you need to stay calm. You don't need to be anxious, because if you're stressed and all your breast milk will not flow. So we have the first one that in fact, this one, I've seen a cartoon. I saw a drawing of 2 women, a woman with a small breast and a woman with a big breast. And the woman with the small breast had a very big baby, while the woman with the big breast had a small baby, like they're trying to just, so your breast is small. It doesn't mean that your breast milk doesn't mean that you will not be able to produce breast milk. That's a big no-no. It's a big no-no. The breast size does not determine the amount of breast milk you produce. What determines the amount of breast milk you produce is how often you breastfeed, how your baby is able to latch on to the breast, right? It is not by size. And then the breastfeeding will ruin the shape of your breast. No. Is age, is that as we get older, our muscle fibers, our collagen, right? As we age, right? All besides even your breast, your body, right? Your muscles begin to wear out. So it doesn't have anything to do with breastfeeding. Yes, me, but I can see you that cholesterol is not a good milk. It's here. It's it's one of our myths that we're busting today. Okay, we will see that. God have mercy on small. Okay. The next one says, if babies feed a lot, it means they're not getting enough. No, that's not true. So like I was saying earlier, because formula, so that's the mistake that mothers make. So formula feeds have more casein. So they just make the babies get fuller more, and then they can make baby constipated. But because breast milk, so I'm sure you have all observed mothers. I'm sure I want to say a yes or a no. Have you observed that when you're breastfeeding, that first milk that starts coming out from your breast is usually watery? It's kind of watery. Then as the baby continues to breastfeed, you now have the thick one coming out, right? So that's the form milk. That's the one that has a lot of water. And then you now have the hind milk. That's the one that makes the baby add weight. That's why it's very important that the baby suckles very well on each breast. Baby suckles very well up to 10 to 15 minutes. I would even prefer like for this feed, baby suckles here. But by the time your baby wants to feed the next feed, you go to the next breast, you just begin to alternate it. So it's important for the baby to take the fore milk, that watery one, and the hind milk, because the fore milk is the one that has a lot of water. The hind milk is the one that has the fats and everything for baby to gain weight. So, but because breast milk has a lot of water and it is easily digestible, right? As babies begin to grow, and remember, as they begin to grow, as begin to have their growth spots, they now tend to be hungry more, right? That's why it now feels like your breast milk is not enough. I'm sure you can also testify, mothers here, that somebody, when you're buying your baby things, they'll tell you that newborn, just buy only one or two, because before you close your eye, baby is now big. It's not going to be your baby size again. Why? Because they have growth spots, because babies grow. So if you buy they'll tell you 0 to 3 months, just buy maybe a few pieces. But I start buying from 3 to 6 months, because even in 2 weeks, that 0 to 3 months or that newborn you bought for your baby, by the time your baby is like a month old or so, it's not going to be your baby size, because they're growing. And so they now have like cluster feeds, they now eat more. But that doesn't mean that your breast milk is not enough. As long as your breast milk is flowing, as long as you're lactating, right? That's all that you need, right? Then if the breast milk will get bad if the mother gets pregnant, this is another one. So there are situations. My mom was saying that the mothers are wicked for advising to exclusively breastfeed. I know, right? I know. So there are people that I have from someone that went for maternity leave, right? Then it was 4 months. By the time she was coming back from maternity leave, she was pregnant, right? So, and then of course, the best people were now saying, you don't breastfeed this baby. So you have to stop breastfeeding. You have to stop. It's going to affect the other baby. The breast milk won't be bad. It will start. No, even if you get pregnant, you can still breastfeed your baby. You can still breastfeed your baby, even if you're pregnant. You can still breastfeed. So it is not, because your breast milk still contains all the nutrients that your baby needs. So let's go to the next slide. Okay, I've already busted this one, that you cannot get pregnant while you're breastfeeding. Yes, breastfeeding will, yes, tandem feeding. Yes, you can do tandem feeding module. So by the time you give birth to your baby, you can still be feeding the both of them, right? So breastfeeding prevents ovulation, but it is not 100%, so you can still get pregnant. And this one is so important. People have thrown away colostrum, because that colostrum is really brown. It's like brownish. It just looks somehow. But that is liquid gold. That is powerful. It is nutrient dense. It is so important. Like I said earlier, it is a baby's first immunization. So we have people throw it away, that it's dirty milk. Oh, it's the bad one, from your, it's the first thing that comes out from your nipples when you give it from your breast. Oh, no, throw it away. No. Colostrum is small, but it is packed with antibodies and nutrients that babies need. And then a mother's milk will go bad in her breast if she gets angry or if she travels. So we've had mothers that, even if, like they're exclusively breastfeeding, maybe their baby is 4 months, before in the government parastatals, maternity leave was 4 months, but now it's 6 months. So then, you still have some people that have to resume work early, right? Maybe like dependent, right? Maybe 3 months earlier, or maybe you have to make an emergency trip and you have to travel. And they say, once you travel and you don't breastfeed your baby for 2 days, once you come back, that's the end of your exclusive breastfeeding. Your breast milk is now sour. No, are you not a human being? You are thermal beings. Like, does your blood get sour? No. So because you are our body self-regulates. So we are not like refrigerators, right? That you have to switch on and switch off. No. So it doesn't matter, right? You can still come back and breastfeed your baby. So let's go to the next slide. Okay, so how can we provide support? It is very important. This is why we're here. This is why we're here, support. Because if a woman receives support during breastfeeding, she's able to, because she's going through a lot. She's going through a lot. She has gone through pregnancy. Her body has changed. You know, she used to be maybe a size 6, now she's a size 12 or whatever. You know, her tummy has, her abdomen has stretched and all of that. And then she's still trying to get the grasp of, she has gone through labor pains or cesarean section or whatever. And then especially even for first-time moms, this is their first time of, even if it's first-time moms or not, but then she's still trying to get a hang of getting herself together, taking care of the newborn. And remember, I know, see, as a pediatrician, let me say it again, when I had my baby, I had to remove the pediatrician cap off, because now this is my child. Like, so I had that scare, like, oh my God, I have to hold her properly, or I have to do my best. Oh, she doesn't have to, I have to hold her, but let her not fall down. I have to make sure she's okay. So those tensions are there. So that's why all hands need to be on desk, from the spouses, husbands, in-laws, brothers, sisters, everybody, healthcare professionals, support groups, NGOs, communities, the government, right? The government. And that's why the International Labour Organization says that women that are working should have paid maternity leave, because they need it. You can't say because she has gone on leave and then she's had a baby, we're not going to pay her again. And even support from the workplace. There should be a place where she can go and express her breast milk, or if there's a place where some workplaces have crèches where the child can stay and breastfeed. This is all these are important. Why are they important? Because if a woman has this support, it will significantly, help her build her emotional resilience, right? Help her mental health and help her overall well-being. So the other support to some women too, like I was saying, that there's something, I call it expectation versus reality. The expectation is that when you give birth to your baby, you have to start breastfeeding. But some people are faced with the reality, and that is the truth, that when they give birth, their breast milk may not flow. It may not be that, it may not be like something that they did, or it's just maybe for first-time moms, it will not flow, right? So there's a need for, when I gave birth to my baby, I had a cesarean section. And I was supposed to have the cesarean section at 9 a.m., but there was an emergency. They had a woman that had a uterine rupture. They had to rush her into theater. So I was on IV fluids till 5 p.m. before I had my cesarean section. And so when my baby was out, I didn't even see her. My breast milk did not flow. I was sharing with the team for 10 days. Like, I would put her to breast. Nothing was coming out. In fact, the first time I tried to express, I had less than 1 meal. I was crying like, oh my God, I have to do this exclusive. So we had to start formula feeds for my daughter for the first 10 days, and I was still putting to breast. But then I had support. I was taking water, I was taking tea, I was taking pap. And then I also realized that I was also getting, maybe because I'm a health professional and I'm like, oh my God, no, I must exclusively breastfeed. I had to tell myself, come, you have to calm down. I had to lay all anxiety aside. I started telling myself, my boy, I have all it takes to take care of my baby. I have all it takes. And I'm telling you, those 10 days were the only 10 days my baby took formula feeds. After those 10 days, I became a water tank. I became like, maternity leave was 4 months. Then when I had my baby, I resumed work. I had somewhere to express. I would express in the morning before going to work. When I get to work, I would express one more time or twice at work. And then when I come back, so the one I expressed, so I used to label. If you check on my page, I taught mothers how to label their express breast milk. So I'll label it the time and the day. So the one I expressed will be for the next day. I'll put it in the freezer. When I go home, I'll keep breastfeeding her. And I breastfed my baby till she was 6 months. I continued breastfeeding. My daughter stopped by herself. By the time she started complementary feeds, she didn't want to breastfeed anymore. I still had stash of breast milk in my freezer when I stopped breastfeeding. I'm telling you, for someone that did not have breast milk in the first 10 days. So we need support. And I'm saying that because I had support. I had support from my spouse, from family, from friends, and all of that, right? And then it's also very important to rest when your baby is asleep. Mothers, women, you want to be super women. As the baby is sleeping, say, oh, let me go and wash the plates. Let me go and wash the clothes. Before you finish washing all those things, the baby has woken up. And then you have to now put the baby to breast. And then you become tired. And when you're tired, when you're stressed, your breast milk will not flow. So there's a need for rest. These are the things that we can do. And that's why all hands are on deck. That's why this teaching is here. Us tell you that we're here to support you, teaching you what you need to do, what you need to learn, so that you can be the best that you can be. And then why support is also very important. During the postpartum period, mothers have what we call, some mothers will have baby blues, some mothers will have postpartum depression. Now, baby blues usually happen within the first 2 weeks. It's just like, okay, you're just trying to get a hang of, being a mother. Maybe the mother, because of the sleepless nights, she may have insomnia, she may be tired, but she's still happy with the motherhood. She's still happy with this new change. So it doesn't last so long, right? Later she adapts. But postpartum depression, she begins to feel like this baby has changed my life. In fact, I'm tired. I don't like this baby. I don't want this baby. I'm not interested anymore. And so that's why her mental health is very important. And that's why, some people, yes, I can see you, Elizabeth, there's even suicidal ideation. So that's why we're all here to support you. And that's why all hands have to be on deck. Everyone, the government, healthcare professionals, the communities, with village heads, you as a person listening, you would also support another mother. Let's go to the next slide. So yes, like I said, one of the problems too. So what are the practical insights? Okay, now there are cases where women cannot breastfeed, right? I've also talked about it. So difficulty with latching, like I said earlier, latching is very important because if the baby is able to latch properly, right, it will stimulate the production of breast milk. So it's very important. So you need to get to a comfortable breast. Anyone, like we showed a picture of the positioning. You can't be, you see some mothers doing like this, they're trying to bend and their back is paining them. It's so uncomfortable. I know, like I told you earlier, you will learn over time. Just keep practicing, get a comfortable position, keep putting baby to breast, and then your breast milk will flow and you'll be good to go. For lactation, so all of these, if you're worried, if you're anxious, if you're stressed, your breast milk will not flow. But then if your breast milk doesn't flow at all, then of course we will have to give baby formula feeds, like I told you in my situation, right? But then formula feeds is also very important. Like you have to keep it, that's why I like to educate mothers that yes, the baby needs to give formula feeds, but then you need to do it the right way. So I was sharing with the team that I had a patient that came, a newborn that was brought into the emergency room. That newborn was brought with a temperature, that child was 1 day old, came in with a temperature of 40 degrees. What happened? The mother had given birth, normal delivery, but maybe her labor lasted for long in another facility. And she was not lactating. And the relatives that we have, we are a community, but I also like to say, we like to say that it takes a village to raise a child, but I like to say it takes a knowledgeable village to raise a child. So the relatives went to buy milk, because in their bid, they're trying to help the mother, right? So they went to buy milk for the baby and they bought an adult milk, like the normal milk, that for older, like the normal milk that we take, not not an infant formula. They bought a normal milk for the baby and constituted it and gave the baby, and the baby became dehydrated. The baby was having hypernatremic dehydration because the constituents, remember that in the first slide about formula feeds, we said it's a suitable alternative. So it is made in a particular way to be as similar to breast milk as possible, right? So, and besides that, it needs to be made properly, the right volume of water to the right amount of powder, and then it has to be thrown away if the baby remains it, the baby doesn't finish it, so that it doesn't get contaminated. Mothers that are on chemotherapy, of course, they cannot breastfeed because chemotherapy agents would destroy the cancer cells and destroy the normal cells, and it can pass from the breast milk to the mother. So those mothers will have to either get breast milk donors or have a wet nurse or maybe use formula feeds. Mothers that have active TB, tuberculosis, that have not started treatment cannot breastfeed until they start their treatment for at least 2 weeks so that they don't spread it to their baby, then before they can breastfeed. And then, of course, sadly, there are times that we have maternal demise. So in those cases, we can use breast milk donors, we can use formula feeds, or we can use a wet nurse. Next slide. Now, okay, for preterm, babies, of course, babies that are preterm, babies that are born less than 37 completed weeks, right? Especially the ones that are birth weight is less than 1.5, less than 1, extreme low birth weights and very low birth weight babies. We don't encourage mothers to put them to breast, right? We don't, because they're very small, their birth weight is less than 1, less than 1.5. The energy they're going to use to start suckling at the breast, as they begin to suckle at the breast, they burn energy and they lose weight. So we want them to gain weight. So we encourage the mother to express and we feed them with cup and spoon. But then also, one of the good things about this is where skin to skin contact also comes into play for preterm, because mothers that have preterm babies will do kangaroo care that will stimulate their breast milk to flow and then enable them to be able to express more. And then mothers that have mastitis, when their breast is inflamed, right? Their have to continue breastfeeding, use cold compress, use anti-inflammatory medications, and then mothers that have HIV. So because of where we are, the resource center where we are, HIV, mothers that have HIV and their viral load is less than 20 copies can exclusively because they can exclusively breastfeed their child. The risk of transmission is 1% for women with low viral load. But if you have HIV, you cannot mix feed. You cannot give breast milk and formula feed at the same time. That's going to increase the risk of transmission. You can either do only formula feeds. If you want to give a baby only formula, and if you're giving only formula feeds, we ask the question, like in developed countries, mothers that have HIV, they give them formula feeds for free, right? They give it to them. So they tell them, don't worry, I'm going to give you formula feeds. Just go and don't stress yourself. But here in this part of the world, the mother has to buy the formula feed herself. So if you cannot sustain the formula feeds because you cannot mix feed, then you have to give only breast milk for 6 months, and then you continue. So you can stop at 6 months if you want, once you start complementary feeds, or you continue to 1 year. So mothers that have HIV don't breastfeed up to 2 years like other mothers. They stop at 1 year. Once the child is 1 year, they stop breastfeeding, or they use formula feeds alone. Next slide. So how can we advance breastfeeding outcome? What can we do? What can we do? How can we advance breastfeeding outcome, right? So the first most important thing is to implement the 10 steps of successful breastfeeding. Now, this is what the WHO recommends, that the 10 step just simply means that, it has to do with everyone, all hands on deck. There's a regulation there's an international regulation for people that sell breast milk substitutes, right? So it's part of the 10 steps that you cannot just come and sell and tell a mother don't breastfeed, use formula feeds. No, you have to follow the guidelines. There are guidelines. You must always say that breast milk is best, but if breast milk is not available, then you can use formula feeds. And then there's a place for you to ensure that mothers feed their baby immediately within 1 hour of birth. There's a place for mothers to practice rooming in, right? And then to encourage mothers to breastfeed their baby all the time. Next slide, please. Yes, so we have to support women. This support is all around. In fact, right now, some organization, they do paternal leave because the father has to be there and support. So all hands have to be on deck, right? To support communities, right? That's why we're here, even as a community. So there has to be an awareness about the benefits of breastfeeding. There also has to be community network to promote and support breastfeeding. The last slide, please. Next slide, the last slide. Okay, so finally, I'd like to say that for us to increase the growth and survival of babies, the importance of exclusive breastfeeding cannot be overemphasized. Together, all hands on deck, we can raise awareness, provide support to mothers so that our babies can continue to latch onto love. And as a gift to every mother here, I have a new mom's guide. I'm giving it, the link is there. Elizabeth can share to all of you. It's just 30 tips on how to transition into motherhood. It tells you what to do. It helps you to come through, into motherhood with joy. Okay, so thank you very much. Thank you for having me. Thank you.
Wow, Doctor, I need to be seeing the claps and the drum rolls and the, wow, Dr. Esiche, thank you so much. Dr. Esiche is like the gift that keeps on giving. I mean, she came with teaching aids. She brought teddy bear for us. She shared her own personal story. And now she's giving us a free book. You people need to be celebrating Dr. Esiche for being such an amazing facilitator and teacher. Thank you so much, Dr. Esiche, for this wonderful presentation. I think it was very comprehensive and very relatable. There were so many insights. I kept noting, and I saw that there were questions in the chat as well. We are truly, truly grateful for your wealth of expertise that you have so graciously shared and poured out today. I know I told you guys that when you join today's session, there's something for everyone. Value loaded, right? So we are so grateful. We truly, truly appreciate Dr. Esiche for this conversation. So we're going to rush quickly into our post quiz before we come to the question and answer. So Dorothy, can you just kind of please help us launch the post quiz? Thank you so much. All right, the post-test quiz is up. I'd like to encourage everyone, especially if you took the pre-test quiz, please make sure that you take the post-test quiz, okay? This is going to help us to measure our knowledge gain from this wonderful, excellent teaching and presentation that we have just received. So please make sure that you are you are taking the post-test quiz. Just 10 questions. We'd like to see, all that we've learned now. Let's apply it to the questions asked. And while you're doing that, please let us know your questions in the chat. So we'll take them in the order in which you receive them as soon as we're done with the post-test quiz. Thank you so much, everyone. Thank you, everyone. Keep your answers coming in. If you're having difficulty seeing the poll on your screen, please let us know in the chat. Somebody will provide that support for you. But if you can see the poll on your screen, please, we'd like to encourage everyone to participate in taking the post-test quiz. Thank you so much, everybody. I can see how our answers are rushing. It means that we've gained knowledge. Every one of us now, very knowledgeable. You know how she was talking about, it takes a knowledgeable village to raise a child. So now everyone who is in the room today or who joined us from YouTube is a member, a kinsman or a kinswoman in the knowledgeable village today. Thank you so much, everyone. Keep your responses coming in. This will be very helpful for us to keep improving and just measure how you are benefiting from this session. Thank you so much, everyone. I'd like to also encourage, please, if you have questions for Dr. Esiche, she's graciously, waiting to provide answers to some of our questions that wasn't covered in the presentation. So please just put your questions in the chat box. We'll take them in the order in which we receive them. If you also have questions and you're joining us from the YouTube family, we'd like to encourage you, please leave your questions in the comment section. And we would also have your questions taken by Dr. Esiche. Thank you so much. Thank you. We just have a few more minutes to go for the post-test quiz. We'd like to encourage everyone, please, if you're just joining, we're taking the post-test quiz, you can still participate. Please just jump right into it. There's just 10 questions and there are options for you to choose, so you're not filling anything else, okay? So just click on the most appropriate or correct option to you. This is helpful for us in measuring knowledge gain. So we'd like to encourage everyone to be a part of this. Thank you so much. And thank you to everyone sending in their questions. We will take them soon. Thank you, Fumilayo Ojo. Thank you so much. Be like Fumilayo Ojo that took for the pre-quiz and the post-test quiz, okay? So we want to encourage everyone else, please make sure that you take the quiz. We're almost done. We're just waiting for us to complete this and take questions. So thank you for staying till now. Thank you so much. Two minutes to go. And we're bringing this to a close. I beg your pardon, 1 minute to go and bringing this to a close. So please, if you're about finishing you've already started and you're about completing, we're waiting for you so that we can end the poll. Thank you so much. Thank you to everyone who's taken the post quiz so far. We're just about to bring it to a close, but we know that some people are rushing to finish theirs. So I'm going to give 30 seconds more. Please, we're waiting on you to complete your answers to the quiz questions. So please, if you've started already, we'll wait for you to complete it. Okay? Thank you so much, everyone. All right. Thank you so much, everyone. Dorothy, I think we can bring this to a close. We're going to go right into our questions. Or I think we can take the post-test quiz now. Dr. Esichi, just confirming that you can hear me and you can speak so that we can take the response to the quiz question and then
Yes, I'm here. I can hear you.
All right, great.
I can hear you, Elizabeth. I'm here.
So the first question is, skin-to-skin contact helps to promote the following except A, stimulates the baby's reflexes. B, promotes bonding between mother and baby. C, keeps baby warm. D, reduces baby stress levels. And D, helps the baby to pass urine and stool. The correct answer is Dr. E.
E. That's
E, thank you very much. So it helps the baby to pass urine and stool. So skin-to-skin contact promotes helping the baby's reflexes, promoting bonding, keeps the baby warm, and reduces stress levels. Okay. How long after birth should breastfeeding begin? Question 2. She stressed this one so much. I believe everybody should get the answer correctly. Option A, within 30 minutes. Option B, as soon as possible. Option C, within 1 hour. Option D, within 2 hours. And option E, when the baby starts crying. So the correct answer is option.
1 hour. The answer is there. Yes.
Yes.
Within 1 hour of birth. Yes.
Thank you so much. Number 3, exclusive breastfeeding means giving the baby the following for the first 6 months of life. We don't even need to go into all the options, right? Breast milk only, right? Yes, Dr. Isiche emphasized this over and over. She even said for cases where, we understand that formula needs to happen, it is a suitable alternative, but it is not the best. So we're emphasizing again, exclusive breastfeeding means giving the baby breast milk only, not breast milk and water. Okay, thank you very much. Number 4, which of these is an effective breastfeeding practice? Remember, she talked about breastfeeding practices. A, practicing rooming in. B, breastfeeding on demand. C, baby latching properly to breastfeed. D, practicing skin-to-skin contact. And E, all of the above. Dr. E, what's the correct answer, please?
All of the above.
All of the above. I figured that this was going to be a tricky question for some people, like one of those, tricky answers that you don't see coming, right? The correct answer is all of the above. They are all effective breastfeeding practices. Number 5, the benefits of breastfeeding for the mother include all except, remember she talked about the breastfeeding benefits. Some of the data, what data is showing us, right? It reduces the risk of high blood pressure, prevents the risk of diabetes, predisposes the breastfeeding mom to hypertension, prevents breast cancer or ovarian cancer, and reduces the risk of ovarian cancer. So the correct answer is C, right?
Predisposes to hypertension. Yeah, yes. It does not. Yes, it does not predispose to hypertension. Yeah.
Yes, breastfeeding does not predispose a breastfeeding mom to hypertension. Instead, it reduces the risk of it. Okay. Number 6, which of the following options is an appropriate method for a mother to feed a preterm baby who has an extremely low birth weight? Remember what she said. A, putting the babe directly to the breast to suckle. B, express the breast milk and feed via a cup and spoon. C, commence formula feeds immediately. D, add water to breast milk to dilute it. And E, none of the above. The correct answer is cup and spoon. Yeah, the mom is encouraged to express and then the baby is fed, just because, their weight is really low. They don't have a lot of energy to latch and all that. And then number 7, mothers with small breasts do not produce enough breast milk. Small breast life matters. So the correct answer is false. Okay, it's not about the size. So long as you are breastfeeding, the flow will happen, and you are adopting all the practices that Dr. Isichi has shared with us today. Number 8, breast milk contains antibodies that protects the baby from infection. True or false? Everybody should get this, right? The correct answer is true. Number 9, second to the last one, the first milk colostrum is dirty milk and it should be thrown away. True or false? This is false. She actually called it liquid gold. It is liquid gold. You must protect it at all costs, okay? And then for our last question, which of the following can provide support to the postpartum mom? A, loved ones, B, healthcare professionals, C, support groups, D, government, E, all of the above. The correct answer is everybody has a role to
All of the
play.
above.
Yes, all of the above. We all have a role to play in supporting the postpartum mom. Thank you so much. So we're going to go right into our questions. Dr. Shea, the first question here says, is breastfeeding painful or uncomfortable? I'm guessing this is probably a question from someone who's
yes, but initially, I think there are like two questions like that. So the first few days may be painful because you're trying to get a hang of it. You're trying to learn how to position yourself properly. You're trying to learn for your baby to also latch, right? But then as you get a comfortable position, it becomes easier, right? Did you my video to be on?
It's fine, Dr. Suchi. I think you can turn on your video, please. Thank you. All right. Thank you so much. I think this works, right? One of the things that we're learning is information. It's important that we're getting information. You know how sometimes when doctors want, or you're not supposed to give injections, it's not painful, then you now feel the pain. Dr. Suchi is not. She's not giving us that false hope. She's telling us that look, the first few days,
but it's the truth. It is.
Hang of it. Yes, it will be. So just prepare your mind, okay?
And I also want to add that that's why you have to like move from one breast to the other. So after feeding on this one, maybe the next feed you go to the next one so that one can rest and all of that. Yeah.
Okay. All right. Thank you so much, Dr. The next question is, give me a second, please. I'm just trying to pull it up. My first baby doesn't eat solid food even till now. And they said it was because of exclusive breastfeeding. Is there a connection between exclusive breastfeeding and the baby's unwillingness to have complementary feeds?
No, I get that a lot. In fact, I had a mother that said, I will never exclusively breastfeed my child because this child gave me headache, right? What I did, I told you my story. And in fact, my daughter was the one that even stopped breastfeeding by herself, right? When I saw it has nothing to do with exclusive breastfeeding. It has, even if someone had given formula feeds, it's habitual, right? So that's why by the time you now begin to move to complementary feeds, you have to be patient as a parent. You can't stop. So the child may not like this food today, but you can't say that you're not going to give it. You keep trying, and then over time the child will eat. So it's not because of exclusive breastfeeding. It's just whether the mother gave formula feed, that child will still not want to put, because his milk is just easy. The child will still not want to put pap or anything in his or her mouth. So it's not.
Yes, thank you.
You just have to be patient and you have to keep trying. Yeah.
Patience and consistency. Thank you, Dr. Isuchi. I have a friend whose baby, after exclusive breastfeeding, only wanted fruits. Didn't want any other kind of food. Fruits always. So yes, patience and consistency helps. Okay. The next question is, my daughter used to increase with 1 kg each time we go for immunization and we're exclusive. Okay, this person is just commenting about the benefits of exclusive breastfeeding. Okay. I think we have, Dr. E, there was a question around when you mentioned for mothers who are living with HIV, why they need to stop at 1 year. Can you provide additional insight? Why do they need to stop at 1 year as opposed to other moms who go to 2 years? Yeah.
Okay, so they're not, and let me emphasize on that. I saw that as well. So they can stop at 1 year. They don't have to go to 2 years. It's not compulsory for them. They can stop, right? Especially if the mother's viral load is low, right? Because you remember that in the beginning, when baby is like less than 6 months, we don't even want mixed feed because we don't want anything that will cause diarrhea or anything that will predispose to risk. So as the children get older, they can have diarrhea or any form of infection. So you don't want anything that will pose the risk of transmission. You're trying to avoid that at all costs. That's the reason. So they are the only ones that are allowed to stop at 1 year. But if the mother's viral load is still low and she is compliant with her medication, like she's not saying, oh, okay, my is less than 20 copies and I'm good to go. And she's compliant, she can extend to 2 years if she wants. But if her viral load is low, she can stop at 1 year because we don't want any risk at all.
Thank you so much, Dr. Isuchi. I think another question is asking, what is a wet nurse, or who is a wet nurse, I guess.
Okay. So a wet nurse is someone that is she may have her own baby or she may not have, but she's breastfeeding another person's baby. That's a wet nurse. So she's producing breast milk for another person's baby, not for her baby. So like, you know, like when a woman dies or something, right? You hear a situation where they'll say, okay, they took the baby to her sister to breastfeed because the sister already has her own baby, so she's breast. So the sister now becomes a wet nurse, right? That kind of thing. So someone that is providing breast milk or breastfeeding another baby that is not hers, the wet nurse.
Thank you so much. It's an expression. Okay, doctor, this is another question for you, Dr. CJ. Mothers that have given birth to more than 3 children, I want to know if it's true that the breast milk doesn't flow well, no matter how healthy you eat.
No, that's a myth. That's a myth. No, it's not true.
So it's one of our misconceptions. It's not true. Okay. Another question here is, my baby will be 4 months in 2 days. Congratulations. I want to see like claps in the chat celebrating Miss Fatima. But I'm yet to see my menstrual period, except for brownish stains once in a while. Unlike my previous childbirth, I resumed menstruation almost immediately after the 6 weeks. So this person is just wondering if this is a thing of concern or something to
No, as long as you're still breastfeeding, there's no cause for alarm. Like a lot of things affect our ovulation and period, and then your body changes too. So it's as long as you're still breastfeeding, there is no cause for alarm at all. Until you have stopped breastfeeding, like you have weaned your child off breast milk, until you have stopped breastfeeding, and then like let's say after 6 months, your period doesn't come, then we get worried, right? But as long as you're still breastfeeding, there's no cause for alarm.
Okay, thank you so much. What can a woman whose nipple is always, I think this is probably the inverted nipple case.
Yes,
what can a woman do to ensure proper breastfeeding or to basically facilitate easier, enhanced process?
It's so I remember back then, before people knew, I used to say these nurses are wicked. They'll use a syringe and try to extract. It's so painful, right? And I used to be like, my God. But if your nipple is inverted, right? Even so that's why like you have to, even before your baby comes out, like you have to try to try bringing it out, like touching it out to come out. But then a breast pump helps. Remember, when you're pumping, when you're using the breast pump, as it's squeezing, you see the nipple coming out through the shield that is there. So you can try to use express. So maybe like if you fed your baby and your baby has slept, you can express on the next breast. So expressing helps. Then also using your hands to bring it out also would help as well.
Okay, so the easier, more modern way. let's
the breast pump. It's the breast pump, yeah.
The breast pumps and that massaging so that it's not painful. Yeah. Okay. The next one is, as a pregnant woman, how do I ensure that I'm able to produce when I give birth? Okay, this is a repeat question. How do I ensure that I'm able to produce baby? So she's giving a lot of responses already. Dr. E, do you want to just do a recap for this person? Maybe they joined in late. How does she, and she's pregnant, how does she ensure that she's able to produce breast milk when she gives birth?
A lot of things. First of all, don't be anxious. You get all the rest you can. You need help. You can't do it by yourself. If you're stressed out, your breast milk will not flow. So get all the help you need. Try to be calm. Try to rest when your baby rests. And then you can start like I know a mother that started taking PAP. She just started preparing her body. So she started taking PAP. We have breast milk boosters, oats, PAP, carrots. Just eat healthy, right? Those will help your breast milk. But beyond that, you need to allay anxiety. If you're anxious, whether you take a bucket of PAP and you're anxious, your breast milk is not going to flow. So you need to allay anxiety, you need to rest and just be calm. And then use positive affirmations that work. Just keep, saying to yourself, my body, I have all it takes to take care of my baby, and you'll be fine.
Oh, thank you so much. That's a very holistic, profound tip. Thank you so much, Dr. Sicha. I think the last question we have here is around timing for breastfeeding on each breast. Do the babies have to breastfeed on each breast for 15 minutes? Will the nipples be sore? And how do you continue breastfeeding with painful nipples? Yes.
Okay, so it varies. You remember when I was talking, I said that the first milk that starts coming out is watery. That's after the liquid gold, right? After the colostrum. So after we have the colostrum that's dark, and then you have the transitional milk. Then later you have the milk that comes out as watery, that's the fore milk, and then you have the thick one, that's the hind milk. And it's important that with each feed, your baby takes that watery one and the thick one, that's the fore milk and the hind milk, right? And so it's good to put your baby to breast for 15 minutes. But if baby can stay longer, fine. I prefer for this feed, baby suckles on this breast and finishes it. If baby now wants to move to the next one, fine. Then by the time you're coming for the next feed, you move to the next one, because by then that one is full and ready to go, and this one is filling up, right? And then if you have sore nipples, right? Sore nipples is not, yeah, your nipples can be sore, but then that doesn't mean you have to stop breastfeeding. I told you that one of the things that causes sore nipples is if your baby is not latching properly. So you check, is the baby latching properly, right? Then you can, there are some creams that can be applied. You can also apply your breast milk on the sore nipples, right? It helps in healing, right? But then you also make sure that your baby is latching properly. And then you can also move, from when you feed on this breast, you move to the next one, so that you don't keep feeding on that breast that is sore all the time. So all of that helps.
Thank you, Dr. ECJ. It's like the breast milk is a gift that keeps on giving. It helps the baby,
it
helps the mother,
yeah.
even has healing properties for painful, inflamed nipples. Wonderful.
Yeah,
Thank God for the gift of breast milk. Yeah. Okay, so I guess we can probably bring the session to a close. I'd like to thank everyone for your very interesting questions. It shows that you were participating, engaging, and just okay. This is a follow-up question, Dr. ECJ. Can breast milk be applied to babies' rashes or eye infections? I think I've heard this before. What's your take, Dr. ECJ?
That's okay. Well, breast milk rashes, like, is neither here nor there. I wouldn't say put breast milk into the eyes. That's, for me, is a big no. No. For me, it's a big no. But there are different kinds of rashes that babies have. Some babies are born with rashes when they come out, and those ones clear by themselves, right? Some people have used rashes and for their baby's skin and it's cleared. But if you've applied it and it doesn't work, just see a pediatrician and know what the cause is, because of course you have what we call infantile dermatitis. It may be that the cream you're using for your baby or the wipes, the baby's skin is reacting to it. So you need to treat the cause and check. So I'll say that.
So yeah, it's important to seek proper care before just self-medicating. Okay, thank you so much, Dr. ECJ. This has been very helpful. I learned a lot, right? And I like to believe that everyone else also took a lot of insights from this session. So I think we can start to. Sorry, I missed that.
No, I said thank you for having me.
Oh, the pleasure is all ours. Thank you, Dr. ECJ. We are truly, truly grateful. I think so. We will bring the session to a close. I'd like to appreciate everyone. The next slide, please. Everyone who has, sorry, please can you go back one step? You missed the reaction survey. Right. So we just want to take a quick reaction survey. We want to just hear your thoughts about how this session has benefited you and how we can improve. And if you have other topics that you'd like us to also address, please put it in the chat. This one is not a long, just 5 questions on how you enjoy the session, and we'll start to push to a close. Thank you, everyone. Thank you for your answers. If you're in the room, please let us know how the session was for you. How helpful was the conversation on today's subject, right? We just like the chair said today, the support for moms, we cannot overemphasize the importance of it, right? The motherhood journey is a significant and life-altering part of a woman's life. And so every support that we can give to moms, our members, MDoc is delighted to be on that train. So we continue to provide support through our Women's Wellness Project, our Digital Mom Project currently. Our Complete Health app is also available for download, so you can get access to more tailored supports, more coaching supports. Our team members will put the link in the chat so that you can sign up. If you use an Android phone, you can go to Google Play Store and download the app and subscribe. If you use an iPhone or any other kind of phone, you can sign up on our web platform as well. So we'd like to encourage you. We can't wait to support you. So please take advantage of the support that we are providing for moms, and tell your friends, tell everyone you know about the wonderful work that we're doing. So we're going to bring the reaction survey to a close, and then so we can bring the session to a close. Next slide, please. All right, so I think this is slightly late, but I'll just round up the conversation by just saying, we want to thank everyone for making the time. Like to encourage you, this doesn't stop in just today's session. We continue to, provide training, tailored training that addresses the holistic needs of the woman's well-being, the woman of reproductive age, from the financial aspect to emotional wellness to physical health needs. It's important that we are supporting moms the best way that with all the support that they need. So please stay tuned to our platforms, Facebook, Instagram, Twitter, even YouTube and LinkedIn. We'll continue to provide updates on what we are up to and sessions that can benefit you. So please stay connected. And before we go, one more demo of how you can use and subscribe to our Competence app for those who were not here when we first played it. Thank you so much.
This video is a brief walkthrough through our complete health mobile application. When you download the app, it takes you to this page, and then you can choose to either sign up or log in. To sign up, please include your first name, your last name, your email address, your phone number, and a unique password. Please ensure that the password is strong, it is unique, and it is imputed twice. After that, you can now create an account. When you click on create an account, a verification code is sent to your phone. Kindly input the verification code and your account will be active. Now you can proceed to fill in your profile. In your profile, you need to fill in your gender, your date of birth, your height, and your weight. Your height and your weight are necessary because this is required to calculate your BMI, which is your body mass index. And after that, you fill in your level of education and your income level. So after signing up, the next thing to do is to subscribe for a program. To do this, please go to the home page and click on your name. After that, click on profile information and then click on subscriptions to the right. This will take you through a list of the available programs at MNOC. So for the purpose of this video, let's select Propel and we'll select free version and click on checkout. Checkout confirms payment and immediately takes you to fill out a BLA, which is your baseline assessment. After filling the BLA, you'll be automatically assigned to a health coach. Now, to confirm your subscriptions, please go to your homepage and click on My Subscriptions. This will show you the list of all the programs you subscribe to, highlighted in green. You can click on the programs to find out your assigned coach and also retake your BLA if you fail to do so initially. Thank you for watching this video.
Thank you. Thank you, everyone, for taking time out of your busy weekend and busy schedules to come and, gain so much, benefits from today's session. So we'd like to wish you a wonderful rest of your weekend and encourage you. Please remember that this work is collective. We all have a role to play, supporting moms, supporting even we ourselves, moms, looking for, being actively seeking that support where necessary, because the average woman is power mic, strong woman, strong African woman. Please get support, get help, okay? And encouraging everyone, please make sure that you're supporting the women around you, so that we can advance breastfeeding outcomes, advance all the benefit that it has to offer, including our well-being, and continue to have healthier mothers and babies. Thank you once again for coming to our session. Have a wonderful rest of your evening. Bye for now.